Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right premolar region. You can very clearly see that there is a supernumerary tooth which has its own open apex right here. It's very different from the lower right second premolar, which is completely normal in anatomy. There you can see, but its positioning here can identify that this is definitely a supernumerary tooth with an open apex right over the mental foramen. Moving to the upper left segment, here we can very clearly see that there is a odontoma like situation. We've got some multiple supernumerary teeth right here. We're going to show you the transaxial view. So here, if you focus right here, so this is starting from the upper left lateral incisor, which is right here. We move towards, going this way towards the canine, we see the first supernumerary tooth right there, and then you can see the anatomy of the supernumerary tooth is tooth-like. This is where the apex is, and then moving further forward, we can see another supernumerary tooth which has multiple crown segments, and it seems like a gemination like appearance. And then we've got a fourth supernumerary tooth right here close to the upper left fold. Now from the appearance, as you can very clearly see, there's one also right here close to the upper left 5, and you've got a tooth-like structure extending on the palatal surface. All of these lesions are apical and palatal, but predominantly palatal in every case. Now from the anatomy, even though there is no histology that we can confirm, but our differential diagnosis is that this could be a compound odontoma, as their appearance can very clearly identify. This is the axial view, the top to bottom view of the upper jaw. You can see all the supernumerary tooth-like teeth, all the compound odontomas are positioned palatally. They are between the roots of the lateral, the canine in the first premolar, and distal or palatal to the upper left second premolar. When we move to the apical view of the lower right 5 region, so here also you can see that this single supernumerary tooth is positioned between the 4 and the 5, between the 5 and the 6, and you can very clearly see that it is in contact with the roots of the lower right 5 and the 6. Thank you very much.